Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can thrive, be profitable, and successful for years to come. As many of you know, the NSCHBC is a proactive organization with over 300 members, including legacy members, that share their wealth of knowledge and expertise with each other, whether it be legal field, the accounting field, the RCM field, the business management field, value-based care, and more. We have every kind of SME consultant that focuses on the healthcare industry you could want. So for this episode, I'm happy to welcome back to our podcast our fellow NSCHBC member, Jackie Coult of Salt Lake City, Utah. Jackie, welcome.
Thank you. Great to be here.
Have you here? Well, what I'd like to talk about is the do's and don'ts of physician practice startups. I know you're heavily involved in that. I come in on the back end. Once they're started, they're like, okay, now can you help us? So this is really, I think, an important topic because I think you really have some insight on that. And I'd like to start with just, a basic question. A lot of physicians that come out of school just think, okay, poof, now I have a practice. And I think that's probably a misnomer. Would you agree with that?
Well, what we're seeing, the trend now is the students coming out of practice or out of medical school are not thinking about private practice. They're thinking about guaranteed, salaries and somewhere safe and comfortable. And I do believe that the academic world is saying, oh, don't go into, your own practice. And it is so refreshing when you have the innovators coming out saying, no, I want to start my own practice and, I can do this, and they can. They are risk adverse and scared. I mean, they're coming out with a lot of debt. To open a medical practice is more debt. They're trying to get a house. And so, I've seen that it used to be every doctor coming out, I'm going to put up my shingle and they will come. And we just don't have that mentality. But the ones who do, the innovators, it is so amazing to work with them. I mean, I've completed over 251 practice startups, and it's just so fun to see them, in their element and thrive. Private practice is still doable.
So what is the first thing they really need to focus on? Let's say that they're getting out of med school, they've taken their boards, everything, and they know that they are now officially a physician and, residency if there's specialty, et cetera. But isn't there, I would say this is a silly question, but there's paperwork involved, like being Medicare and Medicaid credentialed and HIPAA, and now you've got to get, an electronic health record system. Where do you start when you say, okay, obviously you have to have a plan.
Yeah, and it's funny because I have a due diligence clause in my practice startup that we're going to do our due diligence. We're going to, set up a corp. We're going to look for, areas where they want to practice, what's out there. And then also, what is it going to cost them to start their practice? Because they have to get a loan. And typically, we provide we review the services that are going to be provided and put together a pro forma of all the capital equipment, all the supply costs, staffing costs, projections for 2 years within that area, and just kind of do our due diligence because we've got to know how long it's going to take before we start making money, and what kind of capital overhead. We can get the capital for the equipment, and then it's usually a separate loan for, operating capital. And so we need to know all of that and get our financing, secured before we even, start down the road of contracting and employees and all those things. So I have a due diligence phase where, I've even had existing groups that want to break off in 3 providers, and we still provide the same due diligence, because you have to know where we're going and start the foundation of how much is it going to cost and how long will it take and what is required, just to get the funding and get that off the ground.
So something I
So
was, yeah,
that's,
something I was reading recently, and it was actually in the Journal of American Medical Association, that I don't know if it occurs to some startup physicians, but it probably is something after the fact, unfortunately. But it seems like what they think about is what kind of doctor I want to be, what kind of patients I want to see, that kind of thing. And then, but they don't really take into consideration, and you can tell me if this is a consideration. I think it would be, but again, I'm not involved in startups, is the geographical location they're in. So, you've got somebody, let's say, that wants to open a practice in Des Moines, Iowa. But do you ever say, you know what, if you went 30 miles out, not only would would it be more cost effective for you, but you would also see different types of patients that need, or they don't have your specialty in that area. Is that part of your due diligence as far as trying to encourage physicians that are fixated on, I want to be on this city, but then you look at the big picture and maybe it's saturated with their specialty, or the patient population they want to focus on maybe it might not be there, or you can find if at least you can get them outside their immediate comfort zone. It's almost like house hunting, that they can see that there could be some financial breaks there. Is that something in that consideration?
yeah, we run into that a lot because, we look at other, methods of financing a new practice startup, and some of that includes hospital recruitment. So the hospitals will help recruit and pay for, most of the startup actually. And so if that hospital says, yes, we'll recruit you and we'll help you start your practice, and we need you to go here, then, we definitely look at that. So it depends on if the provider is hospital tied. In other words, they have to have the hospital for their specialty. They want to be as close as possible. But, recruitment, if we can find some fund money out there to help them without, a big loan and more debt, we do look at that. But, it would have to be a non-hospital based provider to be away from the hospital in the outskirts. But there are still quite a few critical access hospitals that still need providers out there. And so they are in rural areas and have funding to help the providers not only start their practice, but educational repayment. So those are like key carrots for them and is very helpful.
Oh, yeah, I can imagine. Yeah, I had a physician recently contact me about, I'm starting my practice and I need your help. And he was jumping the gun. He was getting all into revenue cycle management. He wanted to open a practice in Beverly Hills. And I'm like, did you just graduate? And he goes, yeah. And I'm just like, have you looked at the market in Beverly Hills? Or do you look at the rents and what you're dealing with? Have you talked to a consultant who does startups? And he goes, oh no, I'm going to do it on my own. Well, that was a year ago, and he's still trying to figure it out. And I was trying to refer him to, to really talk to somebody who knows what they're doing. And now he's like, okay, I might have to have some help here because I'm not finding what I need, and it's so expensive. And I'm just like, well, like I tried to mention, and I didn't even know what you mentioned as far as the hospital tie-in. That's great.
Yeah, we try to look at, ways that we can, have that financial assistance, so that they don't have to carry that debt. And it's very helpful for the community, the hospitals and whatnot, and it's great for the providers. Some hospitals, just want to bring them in and hire them, and some of them really say, no, let's, help you be independent. And so we're always very grateful of that, because, that's a great help. And then they're in the communities for 3 or 4 years, depending on, rural or non-rural. And it really helps them create a solid foundation. During the due diligence phase, it's like, well, what is your mission? What is your vision? And, that's going to set the tone for your culture. And that exercise is eye-opening for them because they've not thought about that.
Right.
And
Right.
so we go through that due diligence phase, and I say in my contract, within the next 2 or 3 months, if we can't get the facility or we can't get the funding or we can't get this, then you know, um, I'm you get out and do something else because this was not going to work. And instead of locking them in, and it just seemed crazy to me to if you can't fit in the box and it's not going to work. I had a doctor out in Kansas that wanted to open up her practice. So we did the pro forma, we did all the due diligence, where the market is, vision, mission and whatnot. And it was a negative 3 year in the red practice. And it's like, well, this isn't going to work. And so she had, we figured out other options, and she's happier in the lark now, but starting our own practice was not the right avenue.
Well, and I see some physicians, yeah, they fall into certain assumptions, and I kind of call it a trap. So they start their practice. They don't really think about what kinds of, patients they want to work with, what kind of atmosphere they want. A lot of them don't know the work-life balance they're looking for. And I see them fall into, well, I'm going to be all concierge medicine, but they're in a place that doesn't have affluent patients. Then that's a lot of that because you're paying cash. Or there's thinking that, and I know this is kind of a weird subject just in the times we're in as far as private equity, they promise them the moon and the stars, and you and I both know sometimes it works and sometimes they take all the control back and just to, give them money. And I feel like sometimes the doctors kind of lose their way right at the beginning. So I appreciate the fact that, you really kind of handhold them through the process.
They are really good at what they do and they're really excited. So to have that support is great. I've loved doing it, and watching them succeed has just been, it's the amazingest thing you've ever seen. And to watch them just flourish and go is crazy fun.
Now, the
So
one thing I've noticed about providers too is sometimes, and I try to explain this to my clients too, no person's an island. And nowhere is that more evident than in a startup. You have to have a team of people, not just your employees, that are within your office, but also your support professionals like yourself, like myself, that really help with outside things because they're going to school to be a physician, not an accountant, not a consultant, not a business manager, not an HR, not a lawyer. How do you explain to them that it takes a team and it's not just one person?
when we start doing the pro forma, and going through all the categories and all the vendors that are actually going to be functioning to facilitate, maintenance of their practice, they soon realize. But typically, right out of the gate, it's me, their attorney, and their CPA. So they really have the solid foundation right out of the gate, to help with all the corporate setup, the accounting, the right corporate vehicle for what they're wanting to do, and then, assistance going into it. Especially if, we have other partners coming in, employment agreements, comp models, and all those things that the team's already formulated before they even open their doors. Now, I have a couple of vendors in a couple of states where I've done so many startups in certain states and worked with certain, all the vendors, and there's just certain vendors that are amazing. And so I no longer go out and get bids for, three different vendors. It's like these guys are the best, and let's just use them. That really kind of helps me with the, tools and resources. And it's seamless and very quick. So having those other partners has been invaluable to me, and the providers going forward. I mean, like IT, following you throughout, getting all your equipment, setting it up for you, and then maintaining it and making sure you're, secure and safe and all of those things. You have to have a good vendor, and who is that?
Well, it's interesting because I don't think many physicians think they need a lawyer. So, yes, an accountant, they always know that, possibly a business manager, a consultant like yourself that obviously facilitates the startup. But with all the different contracting issues and the legal things going on, you do need at least the three basics, right?
Yeah, and if they don't have a lawyer, I certainly get them one, healthcare specific. And some don't have a lawyer and some do. It's really about 50-50, actually.
Really? Okay.
Yeah.
Now, how do you get them not to overspend? That's what I see a lot of physicians doing. They think that they can go to Staples and get all the supplies they need sometimes. But, you're talking about, equipment and, EHR systems and like you said, you've got vendors, that you contract with and stuff. But it can be so easy, especially coming out of school with all this debt, for physicians to overspend. And sometimes I see them overspending on stuff instead of investing in employees and, people who really know what they're doing. How does that conversation go in a startup?
Well,
I'm like, okay, here we go.
well, I just had one of those, when you have a champagne taste and a beer budget, you keep going back to the budget, and this is what we have budgeted, and I don't really care. This is what I want, and every once in a while we'll have to go back to the bank and say, hey, can you give us just a little bit extra, or we have to find, another pocket or somewhere to dig it out of. You can't really, for the most part, you can lead the horse to water, you can't make them drink. And it's their practice, it's the way they want to do it. Plastics is classic for this because, they want it to be, elegant and, beautiful and all these things. And then they start, what I have found when they get in trouble is they start listening to the wrong people.
Yeah, I
And
heard that
so what
too.
does that mean? So, you have an interior designer that's, free and working with your vendor, but then you hire an interior designer that wants to have you spend, $10,000 on a couch and this and that. And you try to tell them that's not right. And, you shouldn't need to spend that. And there's other products out there that will give you the same look. But they, love this person. And once they, get going and figure out that, oh, it's on back order, it's not done, it's cost me a gazillion dollars, it's not here. And, they have to learn. It's like your kids, right? You, you give them all a great foundation and they go out in the real world and, they got to fall down and scrape their knees, even despite, please put your helmet on when you ride your bike and,
Yeah. It's crazy.
right?
Yeah. Well, it's funny because I had one client say, "Well, I'm just going to search for I don't know if you'll realize this, but remember, I'm in Southern California. We have weirdos out here." The guy goes, one provider, he goes, "I'm going to just search for a producer who will, create me a television show and I'll just get money from that, to focus my practice on television." I'm like, what are you talking about? Those are few and far between. Nobody wants to, you got HIPAA issues because he saw this show Botched, which is the plastic where there's a problem and they're fixing it. And he was just
Yeah.
like, yeah, I'll do something like that. I'm like, oh my gosh. So that's your backup plan? That's like saying my backup plan is my lottery ticket, you know? It's just
Well,
funny.
and I have to say that Dr. Pimple Popper, she's out of California, and she's got quite the show. And that is all great, and she's doing well, and how many of those reality shows, can we have out in the market before we saturate and you fall through the
Exactly.
cracks?
Exactly. It's just some of the hot pie in the sky ideas are just they're funny to me sometimes.
And hey, I have quite a few. I mean, dentists are very creative in that way, where they're using their patients' marketing, and putting that out there, having recording the whole surgery, and their whole journey, and then marketing that, and even publishing that journey. It's out there, and it's working in some areas. So it's not too far out, but it is, you have to do it, right. You have to have the right people. And that's one thing I tell the providers is, when they start veering off and listening to others, I try to reel them back in and say, look, this is, you hired me for a reason, and this is, not the course you should be taking, and you're free to do what you want, but why don't we do this? And here's a great solution for that. And we can fix this. And typically the ones that don't listen, I'm seeing anywhere from 75,000 to 125,000 dollars off course. And that is not very helpful when your performers come out, and they have to be operating in the 75th percentile anyway just to make a profit. And that additional debt or downfall, wrong billing company, wrong vendor for this, or Sally's going to do this for us, and credentialing or contracting, and that never happens, or they sign a terrible contract, or there's so many myriad of things that I've seen. I can't even tell you all of them. But
There's a panel. Are you going to Colorado for the NSCHBC meeting?
yeah,
You are going. So there's a
yeah,
panel that we came up with called "What the Healthcare." Some simple mistakes that everybody's made. I bet you have stories just for days.
yeah. It's, I have so many amazing docs, and some of them I'm still, 15 years later after setting up the practice, they're either my current doc, or, that I'm still consulting with them. They're innovators, and,
That's
whatnot. And
awesome.
it's like starting a family, actually, with the docs. And it's great. Most of the time, I have to say, they're eager for the education. They want to learn, and they want to do it right. And it's not very often I get the veers. I did recently just turn down a practice startup because of the doctors, like you said, you had a doctor, I want to do it myself, I can do this. And, and I'm like, great, you can do it. That'll be great. And, you know, I, I got to check on her, see how she's doing. But, that was one I could see that was going to be a real challenge, because I've already got my cousin doing the IT. Oh, we've already got, some furniture from IKEA, and we've already,
Yeah.
and
The piecemeal,
it's
I know.
like
I get that too.
patch milling it together. Oh, my husband's gonna help me, with all the staffing, and he's gonna be the, staffing PEO, professional employee organization, and help me with all that. And so those types that, have that vision and drive, you just gotta let them go, and
Yeah.
let them, have fun, and go through the journey, and hopefully they come back, and um are doing great, and having fun with it and what they wanted. But sometimes they actually call and say, well, I actually do need your help. So
Yeah, it's unfortunate sometimes only because we know how to start them off on the right foot. Even when I get into the revenue cycle management side and I have a provider, a doctor or something that says something like, well, my wife or my husband, like you said, or my daughter, I want them to learn all this and they're going to, and I'm like, okay, but they need to learn under somebody who already knows what's going on, already has certified in your specialty, already understands the process. You don't want to send somebody in who's learning on the job because that's your money. That's your reimbursement. And it's so hard nowadays with all the different contracts lowering and, the cuts we get. I try to explain, you want every single cent you can get legally and making sure that, you have the right staff. I appreciate people who have, they want to make it a family business. I totally understand that. But again, you need to have people that are credentialed, that are certified, that are experienced in the process. And I'm sure you run into that as well. One last question, Jackie. In a startup, what's the typical time a doctor can say that they're starting to see that they're profitable? And I know it's going to be different for every different type of physician, big, small, specialty, everything. But let's just say primary care. Let's say you're setting up just a typical primary care. How long does it take for them to be, at least a little profitable?
It takes about 3 to 4 months before they start earning a check.
Oh,
So that's when you start getting, profitable right out of the gate. I have, pediatricians that, may have been working. If they've already had an existing practice somewhere, it's within a month or two. If they're brand new coming out and creating, capturing the patients, then yeah, on the third or the fourth month. I tell them, most primary care, it takes about 18 months to get, up to the median speed of patient volume. And for specialists, it's 24 months, right out of the gate, getting to know the other providers and getting those referrals, is critical but it does take a bit. But yeah, they start seeing a paycheck, fairly quickly. Some of the providers, coming out actually have to have, a paycheck out of the gate, which is why we have, the line of credits to help.
right.
So that they have, they need to sustain their family. And most of them have really struggled through residency or a fellowship on just a small amount of money. So they're already kind of trained to be frugal out of the gate. So I typically don't see them, I need $20,000 a month, but, it's like, well, we can pay our bills on 5,000 or, so they're really conscious of that. And it doesn't take them long.
That's good. That's good. It's nice to know that there's at least a reasonable time, that there's light at the end of the tunnel and a pretty good start. Well, I just want to thank you for spending some time with me today talking about this important topic. I know we have a lot of providers that listen in, and startups is a big, big key and a big topic. So thank you for being on the podcast today.
Well, you're welcome. I love seeing them thrive. And I hear that California actually has a new society that they're creating to help independents. So glad to hear that.
All right, everyone. So to contact Jackie directly, go to the nschbc.org website and click on Find a Consultant tab and type in Jackie's name, Jackie Coult, Coult, and you will have her contact information. Also, as a reminder, registration for our annual meeting is now available at nschbc.org, where you can join leaders and industry experts as they speak in Denver, Colorado, to improve your business and your clients' revenues and processes in today's ever-changing business of healthcare climate. That's it for us today. Don't forget to leave us a rating and review on whatever platform you use to listen to podcasts. Make it a great day, a great rest of your month, and thank you for listening to the NSCHBC Edge podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.